Good morning. I'm Andrew Horsfall. I'm the Chaplaincy and Spiritual Care Manager for East Lancs Hospitals NHS Trust, and it's my privilege and delight to be able to welcome colleagues here to share in this moment of reflection as we begin this week to remember our colleagues and friends and the way in which we have supported one another, worked together, and kept ourselves going through this last 2 years in particular. It's been a poignant time and a hectic time for people working in the health service. And on this second anniversary, we're especially coming together to remember 3 colleagues who passed away during the period of the pandemic, and also every other person who we have cared for and those patients that we've lost during this time.
Thank you, Andrew. Good morning, everyone. I'm Martin Hutchison, Chief Executive, and as Andrew said, thank you very much for joining us in the Garden of Memories this morning. It really is a seminal and profound day, as Andrew said, 2 years on since we admitted and sadly lost our first COVID patient in the Trust. Today is an opportunity to reflect on everything that's happened since the beginning of the pandemic and to honour those people that we lost: Richard Palmer, Christina Baldwin, and David Lear. The sustained efforts of colleagues across the Trust and indeed the wider health and social care system has been absolutely incredible, and I want to thank everyone for everything that they've done and continue to do in the fight against COVID. This does include our incredible response in the hospitals, but also in the wider community. And some real innovations come out of our response. I particularly think of the fantastic vaccination programme and indeed the COVID Virtual Award, which is a national award winner. I also want to remind us that whilst we lost many people to the virus, we actually did care for many, many more who were able to return home to their loved ones and recover. There's still people in our hospitals today and in the community with COVID, 32 inpatients today in the hospital, and our work continues to make a direct impact on their lives. Whilst this response has been protracted and relentless, it is indeed inspiring, and I'm very, very proud of everything that's been achieved. So on behalf of the Trust Board, I'd like to thank each and every one of our colleagues for everything that they have done and continue to do in providing safe, person-effective care to our communities. As I said, COVID has not gone away, and neither do I expect it to do anytime soon. But I know that we are learning to live with it a little more each and every day, and this is positive and something that we can continue to feel hopeful about. Thank you.
Good morning, I'm Sharon Gilligan, Chief Operating Officer, and would like to read a poem for you. Crocus poem. Crocus flowers, daring tiny warriors, fighting their way up through the winter ice. Crocus, daring early spring harbingers of promising days will soon be turning nice. Tiny crocus flowers growing close groups, strength in numbers, seeking where winter snows still may lie. Encircled encampment of floral troops, we march onward to spring. They raise this brave battle cry. Bold strength contained in crocus so small, should winter challenge again. They simply refuse to die. Delicate blossoms possess such wherewithal. I cannot help but wonder then, should not likewise you and I?
For many of us, the COVID pandemic has been like a long and barren winter of storms and whirlwinds. We found ourselves in places that we would rather not have been, and on paths that we would rather not have trod. In fact, if we're honest, we would have turned and run in any other possible direction to avoid where we found ourselves this past 2 years. It's been a time of high emotion where our senses and our spirits have been thrown from one side to the other and have left us in dark places with confusing thoughts and tired bodies. Sometimes we've been sapped of energy, had our support mechanisms taken away because we couldn't touch or hug or hold loved ones, friends, and those who matter most to us. It's been scary, exhausting, raw, and at times lonely. In late September in 2020, we planted this crocus curve here in the Garden of Memories in honour of and remembrance of the patients and colleagues who we lost through COVID. And now, 18 months on, the reality is that we could have planted many more crocuses. The bulbs have sprung to life. Each plant a recollection of a person in whom we've encountered something of them and something of ourselves. Investing time, love, compassion, and medical care to try and bring them through. Each bulb a memorial of a face, a name, a personality, a life. Each flower a story of relationship, of giving and receiving, of shared commitment to do the best for a person in our care. The poem which Sharon read speaks of tiny warriors breaking through the winter ice, of promise of better days, of strength in numbers, of boldness in something so small. And to my colleagues here in the ELHT family, I want to say I see something of you in these tiny plants. You've pushed through the COVID winter. You fought through against all the odds. Through strength in numbers, you've given your all for the patients in your care and have sent many people home to recover and given the absolute best of care, compassion, and love when lives have come to an end. It's true to say that some of us are still anxious, still struggling, still battling through, but the story of the crocus reminds us that should winter challenge us again, if we're there for each other, supporting, encouraging, listening to, and walking alongside, we will come through. Scarred, yes. Changed, yes. Different people, yes, absolutely. But even as individuals, though we may be tiny and feel insignificant, together as a family of healthcare professionals, we might just discover the strength to be tiny warriors again when we need it. We come now to light some candles in memory of those that we're especially thinking of this morning. There are 4 candles, one each to remember Christina, Bridget and David, and then a 4th candle to remember our patients and families, those that we have lost and those that we have supported through the pandemic.